we're going to talk about positioning decision guideline. So positioning decision guide. So baseline projections, you have AP pelvis. So if it's a trauma or includes a trauma, you're just going to take a picture of the pelvis. So AP pelvis, non-rotational hip and proximal femur projections. So you're not going to rotate the hips, you're not going to turn the feet in if they're not able to, or if you're not sure, you're just going to leave the feet the way they are and take the original AP picture of the pelvis to see if there are any fractures. If it's non-trauma, these are usually, you know that they're non-trauma, they can move their feet, everything is fine. You're going to turn those legs in that 15 to 20 degrees. So you're going to do the rotational hip and proximal femur projection. So rotate them in 15 to 20 degrees and then take that image. Here is here is a picture of a pelvis. You're going to want to make sure that you can label all of this. So iliac crest, wing of the ilium, ala of the ilium, the ASIS, your pubic symphysis, don't forget your obturator foramen, your superior ramus, your inferior ramus, your tuberosity, your ischial spine. Make sure that you can label these. And on this image right here, you can see that I've labeled everything. You may have to pause your video at this moment to make sure that you can label everything and make sure you have everything labeled correctly. But definitely use the image before. I think it's in your original PowerPoint, and go ahead and make sure that you can label those. So on this one now, we're going to do a little bit of a quiz me. So the depression or the pit located at the center of the femoral head is and we've talked about this before, so it's that little divot at the top of the femoral head, and that would be the fovea capitis right there. Okay. So which of the bones of the pelvic girdle is the largest? So we know that we have several bones in that pelvic girdle. So are we talking the ilium's the largest, the ischium, the pubis, or the coccyx? And we know that it is the ilium that is the largest bone in the pelvic girdle. Okay. So which of the following bony landmarks is located posterior to the acetabulum? So is it the ASIS? Is it the ischial tuberosity? Is it the iliac crest? Or is it the ischial spine? And we're looking for posterior, and that would be that ischial spine, which is posterior to that acetabulum. So the false pelvis, we know which one's the false and the true pelvis. Form the birth canal. So is the false pelvis forming the birth canal, or is it the true pelvis? So false pelvis is false. It is false. The false pelvis does not form the birth canal. The true pelvis forms the birth canal. So the pubic arch of the male pelvis forms an acute angle. Is it less than 90 degrees, or is the male pelvis the one that's greater than 90 degrees? So this one would be true. It does form that acute angle. It is less than 90 degrees. What is the joint of the joint classification of the symphysis pubis? So we're talking about the symphysis pubis. Is it amphiarthrodial, synarthrodial, diarthrodial, or is the symphysis pubis is fused, therefore it is not an actual joint? So which one are we talking about? It is amphiarthrodial. Okay. So which bony landmark should not be visible on a correctly positioned AP pelvis non-trauma? Should we not see the greater trochanter? Should we not see the lesser trochanter? Should we not see the ischial spine? Or should we not see the ischial tuberosity? So if we remember a correctly positioned AP pelvis non-trauma, we're going to lose or hide that lesser trochanter. Okay, so make sure that you review this, do those little quiz-mes, fill out the, use the labeling for the pelvis so you know which each one of those are. You can recall them, you know what they're named, and that will help you on your critique exam. Okay, so from this one we're going to move on to positioning of the pelvis. That will be our next one.